Does that mean we're live, Wyn?
We're live, yes.
Morning, everybody. Welcome to the Health and Social Care Scrutiny Committee. Bore da, croeso, and yeah, thank you everyone for joining us. We've got a couple of items on the agenda today, but just a couple of admin things first. First of all, Wyn, do we have any apologies, please?
Not received any, Chair.
Councillors, if you know of any apologies from within your groups, I know Councillor Glynn, did you say that Councillor Gareth Morgan, I can't see him on the list, is he having some technical difficulties?
He's in contact with IT now and should be on his way in as soon as possible.
Okay, thank you for that. Right, and any item number 2, declarations of interest. If anyone's got anything to declare on today, possibly unlikely unless anyone is sort of got a second job working to do with the North Powys Wellbeing Programme. No, so no declarations of interest. Minutes from last time. I think it's possibly only me that was at that meeting from councillors. I've read through them and we just need to formally sign them off, so I can propose that they be signed off. Wyn, do we still need a formal seconder from within?
Oh, yes, please.
Yep, if someone could second those. Thanks, Glyn. Councillor Glynn seconded those. Right, thank you. So we're now moving on to our first main item, which is...
Chair,
yes,
sorry.
hello.
Aren't there 2 sets of minutes?
Oh, hang on a second. Hang on, Mike, something funny's come up on my screen. Yeah, I've got one next to number 4, and then it says additional documents. Sorry, I haven't clicked on that one. I thought that was the same one.
There's one from March and there's one from June.
Okay. Oh, yes. Oh, very brief, very brief meeting.
Yes.
Yes.
I don't think the minutes are correct.
Well, we only had a very quick formal meeting because the rest of it was training.
I agree, but it wasn't you that agreed. You proposed to defer the consideration of the matter, which was accepted. It says you agreed to defer on item 2, on note 2.
Oh, okay. So very small.
Very minor, but I'm
small minor amendment.
But I'm a bit picky.
Okay.
It is the actual chairman's decision to defer. Chairman will ask the committee. If the committee agrees, then so be it. And that's the way my recollection is, that the chairman said
when that's fine. Now you said that, I'm happy with that.
Okay.
That's fine. But as a newbie, I just need to know the process.
No, that's fine.
Okay, well, can I have someone to propose those, please?
Well, I'll propose those now, Amanda.
Yeah, I'll second Amanda.
Thanks both. Right. Okay, so moving on to item number 5, which is the annual report of the Director of Social Services, which has been compiled by previous Director Ali Bullman, who has now left. So I understand Dr. Caroline Turner, Chief Executive, is going to lead us through that. Councillors, you have been asked to consider just a number of questions as we're being led through that, and whether or not you feel that it's an accurate reflection of the last financial year, if there's anything that you believe needs clarifying, and also whether or not there's anything in there which you think needs to come with more detail in our forward work programme, which we're coming on to later on in the agenda. Am I right though, Wyn, that this is not really a scrutiny item? Previously, the annual report has always just been for us to note.
It's one of those which is slightly difficult insofar as you can make comment on it in terms of, the reflection of, is it accurate, etc. But actually, it is still the director's report. Is very limited what actions and what things you can propose on it.
Yeah, but I think it's good for our sort of our awareness of where the service has been over the last year.
Absolutely.
and good for us to sort of factor in where we think the current pressures are and the areas for us to explore. So on that note, I'll hand over to you, Caroline. I think you've said you're having some difficulty hearing the audio, so I hope you've caught all that, but I will hand over to you. What I'll do, councillors, is if we can sort of park questions until an appropriate point, rather than just ask questions as and when you feel you want to. Just make a note of your question and then pop your hand up, and I'll see that in the participants bar, and it doesn't, I'll just try my best to note who puts their hand up first and go that way, but it doesn't order you. So if you feel I've not come to you first, sorry, but I'm just going to have to go with the way that I see you as you come up. And if you could keep your microphones on mute until you speak, that would be great. Over to you, Caroline.
Thank you very much, Chair. And as you said, I can barely hear you on Zoom. I'm not sure why. Something to do with my settings here. I can just about make out what you're saying, but please bear with me if I'm not able to understand some of the questions. Now then, this report does relates back to the period April 2021 to March 2022. So it is an annual report on the last financial year. And as you said in your introduction, Chair, it's a report by the Director of Social Services, and therefore it's been written and overseen by Ali Bullman when before she left us at the end of June. In terms of this particular report, I'm happy to present it to committee today. And as you said, we're more than happy to answer any questions on it. But it'd be very much, I think, I'd be relying on the officers who were in post at that particular time during the period of this report. We do have Michael Gray with us from Adult Social Care. We have Rachel Evans from Commissioning and Jan Coles from Children's Services. We also have with us at the committee today Nina Davis, who has now been designated as the Director of Social Services and Housing, but of course the responsibility started outside of the period of this particular report. And also we have Lynette Lovell with us, who's now Director of Education and of Children's Services. In terms of this particular report, one of the main themes really for me was the ongoing longer-term impact of COVID during this reporting year, with an increasing demand and a delay in for people opposed in accessing treatment, that then having a knock-on impact on increased demand at the front door and for services from right across social services. And that in itself then did have an impact on staff in terms of recruitment and retention. And there's quite a bit of commentary in here about how the services maintain staff well-being during that time as well, but it was a particularly difficult year. And I would really like to add my thanks to all who have continued to work during that particular very difficult year and since then as well, because the pressures, the longer term impact of COVID are still very much with us now. The service did come out of business continuity on 16th of May this year. But all of the pressures that were there have now, during this financial year, have now been exacerbated, of course, by the increase in the cost of living, the impact of the war in Ukraine on the economy. So all of that has just added to the pressure that's outlined in this report. And that impact, of course, is not just for our own services, but our service providers as well. The structure of the report is very much along the lines required by Care Inspectorate Wales, as outlined in the Social Services and Wellbeing Act 2014. And that is outlined on the second page. So we're explaining how are people shaping our services, the services we provided during the COVID pandemic, promoting and improving the well-being of post residents, how we do what we do, what we achieved. And then there's a lot of background information then in links at the very end and supporting documentation in the appendix as well. I wasn't intending to go through all of that in detail. I was just going to summarise, but Chair, in the questioning, you may want to take it section by section, and then we can all come in then and respond on those particular themes. In terms of this information as well, it's a really useful summary on at the bottom of page 2. There's a lot of information in the report on data. We've got data on the number of children looked after, on accommodation, and on the pressures on seeking and finding suitable accommodation. There's also commentary on the fact that we've strengthened the arrangements for corporate parenting. And there's a lot of commentary throughout the report on the support we are giving to people to stay at home longer. And of course, that became particularly important during the last 2 years because of COVID and the pressure on hospitals, and also on our care homes and on our domiciliary care as well. Ali has noted in her preamble to the report that lots of the preparatory work we did in POIS in previous years have really helped us to get through COVID. So, for example, people are now able to stay at home independently much longer in POIS than in previous times, and longer than in other parts of Wales. So we've been able to delay admissions to care homes by 4 years, which is really, really good compared to the national average. The report also very much reflects the age profile of POIS and the ongoing concern about the ageing population. We've got a very high proportion of people who are older living in POIS compared to other parts of Wales. And of course, we've got a smaller working age population, and that in itself is then having an impact on the availability of workforce, of family members to look after relatives, and of people in our communities as well. And of course, there's also a reference in the report to rurality and the distances that people have to travel to provide care to service users in POIS, not just our own staff, but our providers as well. And that is then adding to pressures in terms of time and costs. So those were the opening remarks from me, Chair. But if you'd like to go through the report stage, section by section, then I'm more than happy to respond as much as I can. But I would also be very much wanting to bring in Michael, Jan and Rachel to answer any detailed questions that members may have. Thank you.
Thank you, Caroline. Do councillors have any initial questions on the sort of overview side of things at the moment, or are you happy for me to sort of perhaps hand over to officers that can talk about the adult social care side of things and the pressures potentially with the domiciliary care market, because I know that that's touched on sort of fairly early on in the report. But if councillors have got any sort of more general questions on anything that Caroline's just mentioned, pop your hand up now. Can't see that anyone has. No hands up yet. What I would quite like then is just in the section, I think it's, hang on a second, I'm just trying to split screen at the moment. So there's a section fairly early on where it talks about domiciliary care and how we've worked with partners on the care provision, recognising that there are some issues with providers finding staffing. I just wondered if we could have sort of a brief update on how things are with that, and where the challenges are, because it says that we're working with our in-house team to manage our situation safely, and it would be good just to sort of for councillors to get a feel for that, please. Oh, Rachel.
Yeah, I'm happy to give a brief response on that. Yes, I think it's been really, really challenging around domiciliary care over the last year. I think one of the most significant pressures are around recruitment and retention. We've had a lot of information and feedback from external providers, particularly because that represents 85% of our current provision, that staff are just feeling extremely fatigued. And as when COVID has started to become normalized, I suppose, and businesses have opened, a lot of the staff have chosen to be recruited to other sectors. So that's been a significant pressure on the market. That said, we have been working really closely with them to look at innovative ideas such as consolidating runs, looking at the types of support that organisations require in order to improve. We have taken a paper to Cabinet around looking at electric vehicles and seeing how we can support the sector in terms of transport costs and attracting people to the profession. And we're also looking at how we can support in relation to fuel pressures, recognising that as a result of the Ukraine crisis, the cost of petrol and diesel has significantly increased. So whilst things are relatively stabilising in terms of the work that we're doing with the sector, I still think it's a significant pressure, and we're continuing to work together.
And is that a pressure that's the same across the nation?
It is definitely so. I think it absolutely is a national pressure. But of course, in Powys, we're seeing that pressure even more significantly because of the rurality of the geography and the huge distances that staff have to travel. So it's a real pressure. And we are receiving anecdotal feedback from providers that staff are just feeling that it's not affordable to work in that profession. So it is a significant pressure that we have to respond immediately to.
Okay, thank you. Have any other officers got anything to add on that sort of theme of things? Oh, Councillor Karina, I can see you've got your hand up. Have you got a question on this? You're on mute.
No, I'm new to this, but do carers get paid for their travelling time, and how much they get paid per mile?
Yeah, they do get paid for their travel time. So that was part of the Powys Pledge that we introduced last year. And the Powys Pledge is a mechanism by which organisations sign up to in order to improve the terms and conditions of the workforce. So part of that pledge is to pay for the travel costs, and the travel costs are currently 35 pence a mile. Yeah. Obviously, the 35 pence is not at this point in time, but that Powys Pledge is one of the mechanisms by which we're improving those conditions, and pretty much all of the organisations are on the Silver Pledge at this point in time.
But is the Gold Pledge 45p a mile then?
Well, the Gold Pledge, we're taking to Cabinet shortly to request an increase to 45 pence per mile. At the moment, the 35 pence is set by Home Care Association Wales, but there's strong evidence across Wales on a national level in support of an increased mileage rate. So that will be built into that silver rate.
Because 45p is fairly standard, isn't it? Say I used to work for ONS, and that's what we always got for the last 6 or 7 years.
It's the HMRC rate.
Thank you. Thanks very much.
Did you want to come back on that, Rachel?
I wasn't sure what the question was. Sorry.
I think Councillor Karina was just mentioning that the 45p is sort of more the standard rate. I guess the question is whether or not we're looking at applying that level not just at the Gold Pledge but across the board, or is that under review?
I think the 45 pence provides equity with our internal staffing market. So it provides that parity across the sector. So what we would be suggesting is that the external workforce are matched in terms of the internal workforce.
That'd be great.
Thank you. Councillor Carroll. Councillor Carroll, you've got your hand up.
Good morning, everybody. I worked with Powys County Council for 23 years within domiciliary care. I do keep in contact with a lot of staff, and I must say morale is very low, and we are actually losing staff because of the mileage, because of the hours they're working. Some are working up to 10 hours a day. And it does worry me, because I wonder if it carries on like this, we are not going to have any staff to work in the community with clients. I'd just like to put that point across. Thank you.
I think, Councillor Carroll, perhaps we could turn that into a question to ask what else is being done within the workforce to ensure that well-being is considered, and are there any schemes or programmes being considered on well-being and other support on a sort of more holistic level for the workforce?
I mean, a lot of carers travel is horrendous. I mean, you know, they're on the road traveling for 10, 15, 20 miles before they even get to a client. And I do feel that if, I'm not criticizing anybody, but I do feel if they could use 2 carers in a car in a certain area and they can work together like we did in social services, we would save some money on the mileage, and it would also help the carers from getting stressed.
Officers, is there anyone who wants to come back on that point, please?
Yeah, I'd like to come back on that. I totally agree. I think the morale in the sector across the board is generally very, very low, and that's certainly been supported by feedback from across the sector. There's been quite a significant reliance on agency staff as well, in terms of ensuring that the runs are maintained. I think one of the strong things that have come out of the pandemic, however, is a real partnership approach with the organisations, and certainly a stronger sense of partnership, and seeing organisations as strategic partners has been really, really effective. We've had some really, really good communication throughout the pandemic, where we've had almost weekly calls with the organisations, just getting a sense of some of their challenges. But those pressures absolutely are still being felt. We have done some really quite innovative work in terms of looking at how we can consolidate runs and bring in runs closer together, so that they're far more effective and make the best in terms of reducing some of those travel costs. And longer term, we have got the Health and Social Care Academy, and recognising that our long-term response to this is around the Workforce Futures programme. But I certainly think that will bear fruit in several years' time. So the work that we're doing now in terms of working with organisations around reducing fuel costs, the Powys Pledge, and looking at other ways we can support the sector, are things that we need to do immediately.
If I could just come in there as well, just to add to what Rachel has said. And sorry, I can hardly hear what's being said in the meeting, but I think I've caught most of it. Cabinet will be considering a paper tomorrow on the mileage rates to see if we can bring up the mileage for external providers to the same level as the mileage rates for staff. But we'll need to see as well, you know, what happens with the war in Ukraine and the impact on the economy longer term. So the paper tomorrow is to proposing that we increase the mileage rate for now to 45 pence, but that we do review it in 12 months' time. This is one of the things, you know, we can take action immediately at a local level, and I'm aware that other local authorities are considering similar proposals as well. but a lot of the terms and conditions, certainly for our own staff, will be negotiated nationally. There is, I think we've had the market supplement paper, the market statement paper considered by this committee quite recently as well. You know, there are things we need to be doing longer term, there are some things we need to do locally, and there are some things we are dependent on nationally. But we are very mindful of the impact of the past 2 years on staff, including domiciliary care. We're doing what we can to stabilise the market long term, whilst also doing what we can in the immediate term as well. But I don't think we're alone here. You know, the issues we're discussing here are common to many different parts of Wales, but they're exacerbated in Powys because of the rurality, the distances, and therefore the cost of travel as well.
Thank you, Caroline. I think I'd just like to know as well, on our own internal workforce, I know, I think Ali had previously done some work on this in terms of thinking of schemes and ways of promoting morale and well-being within our own workforce. And I know that started during the pandemic, and is whether that's continued. Do we still have schemes set up for signposting staff to external support should they need it, such as the Powys Teaching Health Board Silver Cloud mental health support that they've got? Is there still a well-being hub for staff that are for our internal staff?
I'll let you know, maybe Michael and Jan come in on the detail of the support available to staff, but of course the support is available to staff across the whole of the council, and similar support is available to members as well. But it'd be useful, I think, if Michael and Jan could come in, but also maybe you know, as we're moving forward, maybe Nina and Lynette would like to comment as well.
I'm happy to come in there and answer, if that's okay. So first of all, we have our corporate wellbeing offer called Care First, and that's a very comprehensive offer for all staff across the council in terms of general wellbeing support, but also counselling as well. And across children's services and adult services, we've also got some bespoke wellbeing offers, including the likes of mindfulness, which makes a difference to many of our staff. And I think it's also worthwhile noting that the cost of living and workforce recruitment and retention has very much been identified as a corporate risk and issue. And so there are wider discussions being had at a corporate level at the moment about addressing these issues. That may include the undertaking of a market comparison exercise where we look at pay and terms and conditions and compare and contrast that with other Welsh authorities, given that this is an issue that's not going to go away anytime soon. And in terms of cost of living for our internal staff as well, we've also been looking in recent times at whether there's anything different we could do about expenses, and seeing if there's a way that we can build into our processes the ability for people to wait less time to claim back expenses given the increase in fuel costs. So there's a number of different things going on in this area at this point in time, but it's all with a view to doing everything we can to support the well-being of our staff, and do everything we can to address these cost of living issues.
Thanks, Michael. It may actually be worth us, once you've done that exercise of the comparison with other local authorities, if Scrutiny could have, if that forms a report, if we could have sight of that, that would be, I think that would be good. I can see Lynette and Nina have both got their hands up, and Councillor Gareth as well. Councillor Gareth, I'm just gonna, I presume your question is on something else. Is that right?
No, it's on Domcare.
Okay, is it to do with the well-being sort of wide issues at the moment?
Yeah, it's just, I just wanted to know, do the staff get paid for the travel time as well as the mileage?
Yes, they do. They get paid for their travel time. Yes, they don't get paid for the commute to work, because that's seen as a commute.
I understand that.
Yeah.
Thank you. Lynette, welcome.
Thank you, Chair. Yeah, I just wanted to come in on the wellbeing aspect there that we talked about in terms of the workforce. And, you know, one of the things that Nina and I, since we've taken up the post, is that we met with staff on the road shows with Jan, Michael and Dylan and other staff. And one of the key aspects that was coming through loud and clear from all staff really was about the ways of working. As you know, throughout the pandemic, we've been working virtually, and some of the cases that our staff are having to deal with are really difficult, as we know from the fact that, you know, social services is a difficult area to work in, and actually they're finding working from home increasingly more isolating and difficult. And so one of the things that was coming through in the roadshows is actually that we need to look at how we work going forward in new ways of working with the staff so that they have opportunities to be together, for those discussions that more senior social workers can have when newly qualified social workers over here, you know, that kind of thing. We need to have a way of working going forward now to help with the well-being. That was something that came over loud and clear to us in those meetings. So I just wanted to assure you in Scrutiny today that's one of the things we'll be looking at moving forward, as how the ways of working going forward, so that we have an agile working arrangement that enables staff to be together as well. I think it's really important as we move forward. Thank you, Chair.
Thank you, Lynette. Nina? Thank you, Chair. And just building on what Lynette's just said as well, you know, we're already talking about the importance of appraisals, isn't it? Appraisals are so important, and regular one-to-ones for staff. So that's something that Lynette and I are really going to be focusing on as a priority in our new roles. And as Lynette said, that meeting in person, etc., is really important. Those team meetings, one-to-ones, and the support and supervision for our new staff as well, isn't it? When we're, you know, with our grow in Powys, our grow our own kind of schemes, it's important that we're supporting and supervising all of our staff. Mindfulness sessions you've mentioned, and I know in the director's report there's reference to that as well. They're going to be ongoing. The staff roadshows Lynette's covered. Just very much a message from us of we're going to engage and listen to staff, and that's really important. There's regular staff surveys, and there's also staff forum as well. So just to give you assurance as a scrutiny committee that for Lynette and I, that's absolutely key and one of our priorities. So thank you. Thanks, Nina. When you mentioned about the staff forum, is that an online thing, or is it a face-to-face sort of roadshow, drop-in or anything, to make sure that people get that sort of more personal contact? I haven't attended one as yet myself, so perhaps could I ask Jan if that's okay?
Yeah, happy to. So we call it the employee reps group, and what happens is I think it's every 6 weeks. We ask every team to send a representative. So it could be a representative. We try to avoid managers coming because they have lots of opportunities to speak to senior managers in the authority and to have their voice heard. So we ask for people at every level of the organisation, so admin or commissioners or dom care workers or residential care workers, and we ask them to come along and as a representative of their team. And there's something really powerful in that kind of collective voice within social services, as it has been till now, to really raise any issues, talk about things that go across, also to talk about solutions where teams are already perhaps addressing things that come up and sharing good practice. There's a really good opportunity for staff to meet directly with director or directors, heads of service, and really have a voice. It's good.
Good, thank you. I'm conscious I don't want to jump about too much, but whilst you're on screen, Jan, and I can't see any other hands up, is there anything sort of within the report that you want to sort of highlight to councillors in respect of children's, where you think, that obviously there have been various different types of pressures? I know we've touched on workforce really already, which I know is the case in children's, but what about placements, and in particular residential placements? I know there's been a lot of pressures in that area. How have things moved over the year, and are we in an improving position?
Right, okay, placements. Yeah, 3 key pressures on the service: huge increase in demand, real deficit in workforce availability and placements. And the placement situation across the UK is not getting any easier. The placement situation across Wales is not getting any easier. We do seem to have had some traction nationally now. The powers that be do seem to be more aware. So I think that, you know, for example, we work really closely with CIW if we have to have a placement for a child that, you know, you'll have seen some headlines around children being placed in caravans and all sorts of things that have been being in the press and in the media just lately. And, you know, it's really important just to say that no one working in children's social services anywhere across the United Kingdom, and certainly not in Powys, choose to have to have an unregulated placement. We know that it's unlawful. We know that it will usually not be the best thing for a child or young person, but it is a necessity because there are not sufficient placements. And you know that that's something that we've been working on here in children's services over the last 4 years, 3 and a bit years, to really address that deficit. We are making progress. We have a children's home in the south. We have a placement, a property purchased in the north. We've had additional properties allocated to us from housing in order for us to be able to set up new children's homes. All of these things will ease the pressures, but they all take time. You know, you've heard me say this before, children's social services is the most highly regulated of all council services, and rightly so. We're talking about precious, fragile young lives, completely in the hands of people who, you know, don't know them, who are not their family usually. So these things take a great deal of time. For example, we are just readying a property in the south of the county for a young person who needs to come out of a specific placement, getting that ready for them. It won't meet the requirements of CIW because it will not have the fire suppression system. Now, I'm always one to roll up my hands and plug in a washing machine and all sorts, but sadly, none of us can fit a fire suppression system into a property. That's a very technical, very specialist service, and we have to wait until that can be done. So that's just one example of the kind of thing that will cause delay. Of course, what that means is, while we don't have the right placements, we have children in the wrong placements. When children are in the wrong placements, I mean, it just never works well. It doesn't work well, most importantly, for the child. It doesn't work well for the staff, and it very often doesn't work well for the community in which the young person is living. So this is a long-standing problem of decades here in Powys. We are addressing it. It will continue to take time, and I would only ask that you as elected members continue to support this approach, because in my opinion, there absolutely is no other way. We've seen what happens when we are at the mercy of the market. We've seen what happens when we have an over-reliance on people who don't really have a responsibility for the children. No one will do the right thing for our children in Powys more than we will in children's social services. So, you know, I really do urge you to continue to get behind this plan. It's working well. And you know what, next year you're going to see a massive improvement in children looked after numbers, in our placement capacity. All of the work of the last 3 odd years will begin to come through next year. So it's tricky times right now, but please do stick with it.
We will keep an eye on those looked after numbers as they come through in our performance reports. But thank you for that. Councillor Liz, do you have a question on this? On mute, Liz.
Sorry, Chair. Yeah, I think this would be a good one to go on to our work programme. But my question's slightly different. It's about the child protection figures.
Yep.
can I ask a question on that? Thank you, Jan. I see there's a massive increase in between April 2021 and March 2022 in child protection figures. Sort of, I think, like more than probably 65% increase if I'm reading it right. But I just wonder, is that trend continuing in April, May, June, you know, of this year? Are we seeing the same level of increase? Because it is sort of must have been probably an increase of a child per week. And, you know, can you say something about what that looks like now, and you know, the impact in terms of staffing? Because I see that, you know, you've done very well, in fact, in getting 12 you know, children's social workers on the Grow Your Own, you know, and into training. But it would just be interesting to know what your take is on that, and how you feeling about it in terms of the risks.
Yeah, happy to. Thank you. Right, yes, there's been a big increase in child protection numbers, and what we've done is we've put in some senior management oversight on that, just to have a look at it. So if you think about the increase that we've seen at the front door, you know, it's carried through. So what we've said is that by keeping an eye on these things, on the whole, you know, when you take things in the round over a period of time rather than week by week or month by month, the ratios of where the work is going has maintained the same. So, but we don't want these numbers of children on the child protection register unless they ought to be on the child protection register, because as you rightly have pointed out, Councillor Liz, it has a massive impact on the workforce. So, you know, the regulations, what we have to do, our statutory duties to children, quite rightly, who are on the child protection register. And just for those of you who may be new to this area of work, if a child is on the child protection register, it means that a multi-agency panel, so that's social workers, health, education, police, and others, have come together and recognised that a child either has suffered significant harm or is at risk of suffering significant harm. They're likely to suffer significant harm. So it's a really big deal for a child to be on the child protection register. It's where we have kind of the most of our powers, if you like. We, you know, can insist on information being passed to us from other agencies. We override the consent of parents, because the child's right to protection overrides the parents' right to privacy or a family life in many instances. So it's a really big deal. So we only want absolutely the right children to be on that register. But once they're on that register, quite rightly, there's a lot of things that we need to do to make sure we're keeping children safe. It's where the risk is most heightened. So you know that we're trying to make sure that only children come into care where they absolutely can't be cared for by their families. What that means is that they may be on the child protection register while we support families to make the changes that they need to, so that the children can stay with their families. But you've got individual social workers going out, visiting families, having conversations and making those judgment calls on a daily basis. Has this risk now become too great for this little one to live at home? Do we now need to think about them coming into care? Can we put in some different resources and keep that risk down, so that although a child may be likely to suffer significant harm right now, we do think there's hope for those changes to be made? So these are the decisions and the judgment calls that people are making out there on your behalf on a daily basis. We've got senior management oversight now, Councillor Liz, of those decisions that were made around undertaking a Section 47 investigation. That's Section 47 of the 1989 Children Act, and is a child protection inquiry. I know you know that, but I know some of the colleagues on the call might not. So we're making sure, because another added factor here is that we've had the reasonable chastisement kind of excuse for hitting a child has been removed. So we're just keeping an eye on what impact that might be having. Police and social services have a different approach to this, although we did do a great deal of work to set out a framework under which statutory agencies would work. that's not quite going to plan. So we're reviewing that with police colleagues. We're just checking whether or not that's having an impact. So we've got senior manager oversight of that decision to go to section 47 investigation. We've also got what we're doing kind of reflective pieces with multi-agency professionals when a decision is made for progression through to child protection conference. That's where the decision is made about registration for child protection. Now, we're just asking people to look together, reflect together as to whether or not we could have worked with the family in a different way rather than that child be placed on the register. So, you know me, if a child needs to come into care, they'll come into care. If a child needs to be on the register, they'll be on the register. We're not going to, mess about and do anything that is not right or in the best interest of the child. But what we do need to do is just check our practice and make sure that, given the current environment of limited external resources, limited community resources available, increased demands, pressures on families, and there is an atmosphere out there around children's social services. There have been high-profile deaths across the UK. There have been high-profile deaths in Wales. This research shows that this can cause a reaction in multi-agency professionals who make decisions about child protection. And we're just asking professionals to just consider the risks, to consider the resources available, consider whether we can work with families at the lowest level possible, because that's what we always try to do here. So there's a lot of work going on. We're very, very aware of that increase. But I think something that you should be pleased about is that that has not translated into an increase in children looked after numbers. Yeah.
Thanks, Jan. I'm just conscious that there's only sort of 10 minutes left on this agenda
Sure.
item. Councillor Jonathan, is your question to do with children's services?
Yes, it is, Amanda. It's very brief, really.
Yep, go for it.
Okay, thank you. It's to Jan, really, and I'd like to thank Jan for a very honest appraisal of what is clearly a really difficult situation, not just in Powys, but nationally in Wales and in the UK. And it must be really challenging and really, really difficult to work in that sort of environment. And I just wanted, from her, to get an understanding of whether the difficulties that they face in that service are approaching a point now where, she fears for the level of risk that some of these children may be exposed to, and how close we are to a point where it's really very serious.
Is the crux of your question, Jonathan, sort of whether or not, because of the increase in pressures within the workforce and front door, whether or not our resources can handle that, or whether or
sorry, in a roundabout
yeah,
way,
are we absolutely at capacity of what we can handle if
yes,
things get worse? Yeah, okay.
You've summarized my point very well. Thank you.
Jan.
Okay, thank you. And thanks, Councillor Jonathan, for your acknowledgement of the difficulties. I appreciate that. We've been in that position where things have been critical, and we had a summit back in, I want to say March. It was around that time anyway, forgive me if that's not quite the right date, where we brought together the managers in the service with the director, and we spent the day looking at what we needed to do to manage the risk effectively within the resources that we had, whether or not we absolutely needed other resources, and whether or not we were at the point where the director made the decision that we were not able to carry out our statutory duties. So we've been in that crisis situation for some months now. We're not approaching it, we've been there. What we were able to do, because you've got a team here who are second to none. They're absolutely outstanding. And so what we were able to do was really pull together, look at the way we needed to kind of change things. We have drawn down kind of COVID pressures resources that had been set aside for us should we need them this year. So we've drawn down those. We increased capacity in the teams. None of these have been ideal situations, because when you're kind of managing a crisis situation, it's difficult, isn't it? We are in the, we set in place what we call our 3 R's plan, and we're in the kind of, we've been in the recovery phase, we've been reshaping, and things are going to plan, but there's been a number of positions in the service that have been temporarily funded to deal with what we hoped would be a temporary increase in demand. We're at the position now where, you know, since June 2020, that demand has increased. I don't think in July 2022 we can keep saying this is a temporary increase. So what we're doing is just looking at how we need to reshape the service. We know that as our children looked after numbers come down, you know, capacity is released there. But what we do know is that the demand is unrelenting at the front door. So we're just looking at, have we got capacity in the right place within the service, and what else do we need to do? And that's a piece of work that's ongoing. There's a paper coming forward through to Scrutiny and to Cabinet in coming weeks, which will set that out. But I think, you know, we can't keep saying that this is going to be a temporary situation. No. You know, hopefully in the next few years it'll stop and then we can change things again. But for now, you know, we need to manage the demand that we know we're still having.
Yeah. Thank you, Jan.
Thanks, Jan.
Can I just come in there just to add to what Jan has said there as well, Chair? You know, we've looked at every possible option to, you know, stretch the resource within the service as much as possible and bring in, not just in children's services, but adult social care as well, and where necessary, bring in additional support, whether it's temporary support, and in some instances we have brought in managed services as well for certain categories of work. It's not a matter of not enough money, it's a matter of not enough qualified social workers and domiciliary care workers as well, and that's not just a matter for Powys, it's a national, it's a nationwide issue. But you know, I'm really pleased with the way the services have been flexible and have reviewed and changed their, you know, moved their resource around to make sure that there is senior management involvement and there is as much guidance as possible to all of the teams. And while I've got the floor as well, you know, I'd just like to thank Jan. You know, Jan will be moving on to a new role over the summer, and Jan has really, you know, made a tremendous contribution to stabilising and leading children's services in Powys since she joined us 3.5–4 years ago. So thank you very much to Jan.
Yeah, thank you for saying that, Caroline. I was also at some point going to say that now seems as good a time as any, but in particular, Jan, the passion that you have brought to how you feel about making sure that all of our children are kept safe has just been, you know, your passion shines through when you speak, and it's really, you've really put the focus for us councillors where we need to apply it because of that. So thank you. I know Councillor Sandra, as portfolio holder, do you want to come in on this as well?
Yes, please, Chair. Well, most of what I was going to say, my thunder has been already taken. I wanted to commend the staff in the way that they've been vigilant and proactive in prevention work, which is, you know, how do you measure prevention work? And the answer is by how many actually, you know, anything progresses to become very serious. So commendable to the way that that officers and staff have rallied together to put good practices into place for the prevention. And I just wanted to thank everybody, and especially Jan. I've heard a lot about, and I've managed to catch up many times with her on what's going on, and thank her and wish her well in the future. But I welcome the report because it does state, and I've always said, the warts and all. And unless we know the warts and all, how can we be proactive? So the honesty is the best approach, knowing what's in front of us. And I know we've got a lot of new officers and a lot of new portfolio holders, and it's a steep learning curve for us, but I'm sure that putting our heads together, we will get through this and continue the good work that has been there. Thank you very much.
Diolch, Sandra. Councillor Sian, do you want to add anything as portfolio holder from for adults' perspective? I appreciate there's sort of quite a lot in this report for us as councillors to unpick, and that's not really, it's not a scrutiny report really, but it is been a really helpful exercise to sort of focus where we may want to look at in the future. So is there anything you want to add?
Yes, and well, I want to echo Sue's commendation of staff. You know, I'm a brand new councillor as well as a brand new portfolio holder, but I found certainly my weekly conversations with Michael and with Dylan also just massively helpful and reassuring, actually. Dedicated members of staff who've absolutely got a handle on their jobs and are innovative in their thinking, and just I've got a huge amount of learning from them, and I really like working with them. So thank you to all of you, and I regret that I didn't have a chance to get to know those who are leaving a little bit better before they left. I've got an idea around so things that have emerged for me through the market stability report and Ali's report as well. I've got an idea. I don't know whether to raise it in agenda item 8 though. It's an idea for, or a request, I suppose, for forward work rather. I can talk about it here if you think this is an appropriate point.
If we leave that for item 8, because I think there's probably a few things that have cropped up from this report that people may want to add to that. I know we haven't really even touched on budgets or finance that are mentioned in this report. And just before we move on to the next agenda item, sort of one request from me to senior officers and to Caroline is obviously on our forward work programme, we've got quarterly scrutiny reviews of the budget position for both adults and children's factored in, but we've got a lot of new councillors here, and before we do that, I think we could really do with some member development on the budgets, so that we can do that effectively. I know previously Jackie from the children's side of things took us through how the children's budget is made up, so just basically, you know, what it looks like and where all the money goes and the different departments, and just so you know, when we come to scrutinize that, it actually makes more sense. And I think it would be really helpful to have quite an in-depth session on adults and children's finances before, I think it's down in October. So if I could make that request now, because I know finances are just sort of are touched on in this report, but it just seems worth mentioning that now. And I think I'm going to close this agenda item now, because we've still got the North Powers Wellbeing Hub to get through. Thanks to officers for coming to talk through on this. I don't think you're all going to be here for the second part, but again, want to reiterate a big thank you and a good luck to Jan in your new role. When's your last day, Jan?
It's still to be kind of sorted out, but I think that I'll probably have some leave the last week in August, and hoping to start my new position in September.
Well, all the best with that.
And Chair, can I just say as well, I mean, Wyn's with us, it'd be really helpful, I think, if Wyn can arrange with officers some briefing sessions, some member development sessions, possibly 2, one on children's service budgets and a separate one on adult social care budgets for September, so you're fully briefed then before the scrutiny of finances in October.
Yeah, that would be great, thank you. Right, so the next item, hang on, let me just get that up, is item 6, which is the North Powers Wellbeing Programme, and we're having Nigel coming back. Nigel's here, and then I think we've got, is it Sally Campbell from the Health Board? Is Sally here?
I'm rather hoping so, Chair, because she's the main speaker here.
I can't see her on my list.
She did email me to say she was joining about 11 o'clock.
11 o'clock, okay.
So if I open up, Chair, if that's okay, I'm hoping Sally will appear miraculously in a coordinated way anytime soon. Yeah. So I thought I just quickly introduce myself and my role, and picking up your point earlier about plenty of new members involved. So I've taken up the SRO role for North Powers Wellbeing Programme. following Ali Baldwin's departure. I was involved in the background previously, but I'm now fronting it up as on behalf of EMT. So my counterpart in the health board would be Hayley Thomas. So I'm just getting into the swing of things. I had a couple of meetings with Hayley and Carly and the team, but I'll obviously be liaising with the committee going forward. So I'm happy to declare that. We do have quite a few slides, and they have been circulated previously. So I've messaged Sally. I think what we do is try and run through them fairly quickly, and then open up a discussion, a bit of a debate on some of the detail there, because don't make assumptions about what people know about the programme, but there's been quite a lot of this. So for members who've been around some time, they'll have seen it a few times. I heard about quite a lot about it. For those perhaps newer to the council, there's probably quite a bit to take on board there. But clearly a very exciting, very interesting project. So I'm hoping that Sally has now appeared and is going to take us through the slides.
Is Sally here? I can't see her on my list. I think what would be just really helpful, I know that the presentation has been sent around everybody, and it gives sort of an overview as to where you're at, but just going really right back to basics, Nigel, it would be helpful to have a sort of an explanation as to what it's envisaged the wellbeing hub is going to be, because it's wellbeing hub is a bit of a cryptic term, really. So, and some people refer to it as the new Newtown Hospital, which also isn't particularly accurate. So it would just be, if it just to give everybody just a flavour of what it is, so that when we get the presentation, it all makes a bit more sense.
Yeah, happy to do so. I've got a message from Sally, who's struggling to get in on Zoom. The curse of Zoom, everyone.
When are you able to help Sally with that?
And she's of course PTHB, so sometimes jumping across to the organisations.
Struggling here a bit. I'll try and see if I can invite her in now. Bear with me.
But Chair, happy to move forward. I should have added, of course, we've got a colleague on the call, Neil Clutton, who's been involved in the not surprising, given Neil's role as property manager, the property and infrastructure components of the project. But I'm more than happy to kick off, Chair, and share my screen.
Yeah, I'm just wondering, Chair, I mean, while we're waiting for Sally to come in, it might be useful for me to just explain a little bit about the background of the project and the aim of it.
Yeah, that would be great.
It was very much driven by data, the analysis of the data going back to about 2018. The Welsh Government invited all regional partnership boards to prepare bids for significant projects which would enable integrated services for health and social care in different parts of Wales. And in Powys, the decision was made based on the data in terms of where the need was, distance to services, that Newtown would be a really useful hub for the north of the county to bring in more services, day services mainly, into the area to reduce the need for travel, for example, to hospitals in Shropshire in particular, but also have a new centre that would enable the integration of health and social care, introduce a new model of care, which we're now developing and rolling out across the county. And I'm sure other officers, if they're still here, would be able to talk a little bit more in depth about that. But the idea was that Newtown was the one place that was furthest away from health services, in particular in Powys, compared to provision in Llandrindod and in Brecon and elsewhere. And that this opportunity really gave an opportunity to integrate health and social care services in a much more meaningful way than is currently possible. And that hub would then be the centre for those services for the whole of the north of the county, including the rural area surrounding as well. So in terms of the different components, I'm sure Sally will take you through that when she joins. But it's not a new hospital. It's a health and wellbeing hub, providing an enhanced level of diagnostic services than is currently available, and also having more day facilities for treatment than is currently possible. And by doing that, reducing the need to travel. because people in North Powys travel in many different directions, not just to Shrewsbury, but to Aberystwyth and to Wrexham as well. So the reducing the need for travel, having more services and diagnostics available locally, but in an integrated way with social care and the third sector as well. So that is at the heart of the project. There are other facilities planned to be on site as well. So we've got the new junior infant school that was merged, which is now a merged school on one site. So there is a desperate need for a new building for that school, and Lynette can come in on that. So planning that school to be alongside and part of this hub in an integrated way, and being a community school that is very much linked to the health and social care facilities available as well, which then follows the policy direction of Welsh Government. There is a library currently on that site as well, so the plan is to remove the library and build a new library facility as part of this integrated centre. There are also plans for supported living on site, but this project has now been in development for the past 4 years, and we do now have supported living available nearby in other parts of Newtown, so that is now less crucial than it was. And another element that's quite important for the Health Board in particular is accommodation for staff in particular. But I can see that Sally's joined us now, so hopefully that's the brief introduction is just giving you a little bit of a feel for the facilities that will be available on site, and the importance of this hub, not just for Newtown, but for the much wider area as well.
Yeah, thank you, Caroline. And Sally, I can see you're in the meeting now. And yeah, no, don't worry at all. I know technology is not always the best with these things, but welcome, and thank you for the presentation, which I know Carly sent through already, which hopefully members have had been able to have a brief look at. But yeah, I think today you and Nigel are sort of taking us through where you're at now, really, and how things have changed since the last meeting we had with Carly Skit, and where things are going over the next phase over the next few months.
Yep, that's fine. Do you want me to take you through the whole presentation, or do you want me to start at the slide that sort of sets the scene as to where we are now? I'm just conscious there's new faces in the room, and I think maybe from the beginning might just be helpful.
Yeah, I think probably from the beginning, but we've had a quick overview from Caroline on sort of what it's envisaged the hub will hopefully look like in terms of the ideas behind it. So feel free to go through that first section fairly quickly, if that's okay.
Yeah, no problem. Just figuring out how to present.
That's up, I can see that. Yeah, but your sound seems to have gone slightly quieter now.
Is that better?
Oh, not great. It was absolutely fine initially.
Not moved.
Oh, there we go. That's better. There we go.
Okay, I won't move from here. So yeah, it's really good to be here and to see you all. I'm Sally Campbell-Tate. I'm the Service Planning Manager in the North Powys Wellbeing Programme team. And this slide just sort of gives a bit of an overview of who we all are. We've all got different backgrounds, different professions in the team. We're headed up by Carly Skit, who's our Assistant Programme Director. So in terms of the goal for the North Powys Wellbeing Programme, this is derived from the Joint Health and Care Strategy that was developed in partnership in 2017. So the overall goal of the programme was to test and deliver a new integrated model in North Powys and to support effective learning and transfer across Powys. There are a number of key drivers behind the programme and a real need to do things differently in order to sustain our services across health and social care and deliver better outcomes for our citizens. So the programme aligns to a number of national policy drivers, including the key principles of the wellbeing of future generations Emissions Act, the Environment Act, with the programme having its own green delivery plan, the Social Services and Wellbeing Act, and A Healthier Wales, amongst many others. At a more local level, the programme supports a number of local policy drivers, delivering the objectives of the healthy care in Powys, as well as moving towards delivery of a carbon positive Powys as set out in the PSB's wellbeing plan. We often get challenged on why North Powys and why Newtown. So in terms of the North Powys focus, the population needs assessment highlighted some stark statistics for the communities in North Powys, which we know have been exacerbated by the COVID-19 pandemic and more recently the cost of living crisis, which has not taken full effect yet. From a health perspective, there is an inequity of service offer across the county, which means that citizens in North Powys have to travel out of county to access interventions that can be done in county in the mid and the south. There are also a number of drivers behind the Newtown focus, including high levels of deprivation, which again will have been exacerbated by the pandemic and the cost of living crisis. The buildings we have in Newtown currently are in poor condition with significant backlog maintenance, and they don't lend themselves to collaborative or integrated working. And there is a broad partnership opportunity in Newtown due to investment in the area from a number of key partners supporting the vision for more integrated services and joined up care. So in terms of the journey we've been on, the programme was formally launched in 2019 as a result of the health and care strategy, and we progressed well prior to the COVID-19 pandemic, and we were funded via Welsh Government transformation funding. There was a significant focus on public and staff engagement during 2019 and into 2020, the outputs of which have informed the development of the new integrated model of care and wellbeing for Powys. Additionally, a population needs assessment specifically for North Powys was undertaken, which heavily informed the development of the case for change. The programme was formally suspended during 2020 due to the pandemic, with the core team redeployed to support the COVID response. The programme was re-established in autumn of 2020, but with limited focus. So in terms of where we are now, we're currently doing our OBC planning, our outline business case planning, leading transformative work across 5 key systems. Those key systems are the integrated community model, mental health and wellbeing, children and young people, social model for health, and planned care to support delivery of new service models. The programme business case was submitted and endorsed by Welsh Government in March 2022. The strategic outline case for health, care and infrastructure was submitted to Welsh Government in March 2022 following approval by Cabinet and Board. A memorandum of understanding between the Council and the Health Board has been developed, which contains a set of partnership principles to support operation of the campus. In terms of immediate change on the ground, there are a number of short-term accelerated projects funded via the programme, which are delivering new ways of working in the short term alongside longer-term planning for the campus. A stock take was held following submission of the strategic outline case in order to inform the next phase of work. A number of key themes were identified during the stock take, which are listed here. So in terms of those accelerated projects that I've just referred to, they span a range of focuses, and this slide demonstrates the impact that they're having. The Powys Together project is led by Jo Hughes in Children's Services Commissioning, and the project focuses on working with families in Newtown and Welshpool. And during the last year, they've delivered 130 community sessions to children and families in those communities.
Can I just ask a question on that? Sorry, just going back to that Powys Together thing. And I'm sorry, I know I've kind of just jolted your presentation a bit, but I think this is one of the collaborative ones where there's this clear crossover with the with both health and children's. What do those Powys Together sessions look like? What are they early intervention, early help, or are they more are they broader than that?
I think the focus is early help and that low level intervention, and I think the focus is on reducing the need for statutory services. So intervening with those families at a really early stage. I'm not close to the detail of the accelerated projects, but I can find out more about the Powers Together if that's helpful, and send something over.
No, that's okay. I think possibly Jan, and I don't know whether Lynette's still on the call, but I think as we go forward scrutinising this, we need to sort of zoom in on where this committee can be most useful, and that collaborative area is probably going to be one of them, because just looking at sort of the accelerated programs, the ones which are very, very specifically health and not within our remit, such as ophthalmology and respiratory, I don't see how our committee can be super helpful on those. So I just think it's just worth thinking of where we can be best placed to help be part of this project, being as good as it can be. Sorry, Sally.
No, that's fine. I see Nigel's got his hand up. I don't know if you want.
Oh, I can't see that. Sorry, Nigel.
Yeah, I was going to say, Chair, I think it's a very valid point, and I'm happy to sort of front that up as the SRO, and when and where appropriate, look to bring the areas that have more relevance to this committee back for considerations of a scrutiny.
Yeah, thank you. And also from our last minutes where we had Carly last time, we did say that we would, as you get more into the specific operational services that will be run from this project, that we would look to set up a working group from this committee to maybe sort of zoom in on some of those areas. So it might be worth us thinking of that as well. And also then, if there's going to be particular areas that are to do with the school and not to do with social services, I'd previously recommended from this committee that you take those to the chair of the Education Scrutiny Committee.
Yeah.
Noted.
Yeah. Okay. Sorry for interrupting.
No, that's fine. No problem. So the vision for North Powys, like I said, it's been derived from the health and care strategy. It's been further refined and developed based on engagement with staff and citizens. So we're looking to embed a fundamental shift in focus from illness to wellness, focusing on prevention and well-being, upstream support through a more collaborative approach, not only between health and social care, but also other partners who have an impact on the health and well-being of the population, such as education, housing, leisure, culture, and third sector, in order to address the social determinants of health and better support the emotional and mental health needs of the population. We know that inequalities exist across the county in terms of outcomes and access to services from existing and by relocating and integrating services from existing premises in Newtown and acute settings out of county, we seek to reduce those inequalities and improve access to services at a local community level. There's a particular focus on ensuring children and young people get the best start in life. And from an estates and infrastructure perspective, we seek to embrace new carbon intensive technologies to support new ways of working. And we also seek to maximise the use of the resources and assets available to us across public service partners, ensuring efficiency and effectiveness through seamless service delivery models. So there are a number of issues with current provision that we need to address in order to ensure sustainable services going forward and improve outcomes for our citizens. They're all listed there. I won't go through them one by one. In terms of the benefits for the programme, there are a number of indicative benefits associated with the healthcare and supported living and infrastructure elements of the programme. Again, I won't go through them all in detail, but they are categorised into benefit categories. So you could take a look through those in your own time, but they're wide ranging. They span broader than health and care outcomes for people. So the preferred site was determined ahead of the PBC submission. We went through a long listing and shortlisting and scoring exercise, and then the preferred site as a result of that was identified as the park site in the centre of Newtown. It currently houses a number of health and social care and education facilities, which are all marked here on this map and is surrounded by a number of existing facilities too.
Just so councillors are aware, one of the issues that has come up in previous scrutiny on the allocation of this as a site, which I'm sure will be further questions will be asked on going forward, is how safeguarding will be ensured. But given that there's the locations of the schools there, as well as services. So just so councillors are aware that that is something that has been asked and is in people's minds already.
Yeah, could I just interrupt? I can see Neil's dropped in the chat box. He's got to leave at 11:30. So I just wondered if there were any property sort of estates type queries. I can certainly either front them up or defer to Neil and respond by correspondence if needed. But if anything was pressing, anybody wanted to raise, now would be a good time to ask Neil.
I can answer the safeguarding issue. The school will be designed as normal practice with full safeguarding in mind, fully secured and fenced in as part of the wider scheme. So there's no difference to this, but just needs to be incorporated into a wider planning proposal. But the scheme will be no different from any other for the school as we do for any other build we've done in any other we've done across the board, across the county.
Okay, thank you. Have councillors got any other questions just on the sort of location of the site before Neil has to head off?
Not any comments about the site, Chair, except on that slide is on there now. He's got David Fluid School. Our school, David Fluid, is no longer in that site because they've got a new school on the high school site. So that slide, the buildings are most likely still there, but I'm not sure what they're used for at the moment.
I can confirm that you are right, Councillor Gareth. David Fluid moved to a new building a few years ago. That particular building has been used in recent years for the integrated family centre for Newtown. So as an integrated team, partly children's services, but health services in that building as well.
Thank you. And I think because of that integrated health centre councils, you can probably see why the question of safeguarding has come up, although I appreciate Neil's response that obviously systems will be put in place as per any school would need to be. But obviously, you know, there are a number of services within close proximity here. Right, okay, I can't see anyone else's hand up, so I'll let you carry on.
Okay, thank you. I'll try and whip through quite quickly. So Hughes Architects, who are based in Newtown, have developed some early concept drawings of how the campus could look. So this is just an example of something they've produced, and the intention behind developing conceptual drawings was to share them with stakeholders to receive feedback and then further refine based on that feedback. So just another conceptual drawing there. So there are a number of considerations for decarbonisation on the campus. They're listed here, and that's being driven through our innovative environment work stream. In terms of the commercial and financial case, discussions are currently underway with Welsh Government around joint procurement in order to optimise costs and time efficiencies. The total capital and revenue costs at SOC level stood at around 109 million. This was an increase from the PBC, which we were expected, and it was a response to the PBC scrutiny grid, and was also driven by the general increase of the schedule of accommodation, identification of infrastructure costs, and student accommodation. So the work that we do for the ABC now will further refine those costs and delve into a little bit more detail around the revenue through demand capacity, financial and workforce modelling. So this slide just shows our existing governance. Just to note that our governance arrangements are under review at the moment following feedback from the stock take session that we had. The need for streamlined governance was a pertinent theme that came out from that session. Again, a timeline here for the healthcare and other elements of the campus as well as the school, and is currently under review. Programme risks, we have a number of risks currently held on our programme risk register, a number of them scoring fairly high. I think just the main focus is on this really high scoring one, MR6, around not having sufficient operational and strategic capacity resource available to support delivery of the programme. This risk was particularly pertinent during the pandemic and remains so, as the effect of the ongoing pandemic is still being felt across frontline services. And a set of draft priorities have been developed for the next phase of work, some of which are currently being progressed and are all outlined here. And I think that's the end. So thank you very much. Any questions?
That's great. Thanks, Sally. I think, councillors, feel free to ask any questions on this, just to further your understanding, because it's still fairly early days on this whole project, and we're going to be looking at this increasingly over time. So if there's anything you want to ask which isn't a specific scrutiny challenge type question, but what you think just you need a bit of clarity, please don't hold back. I can see, Neil, you've got your hand up, and I know you've got to go in a couple of minutes, so I'll bring you in now.
I just thought I'd just highlight the fact that the school design process is ongoing at the moment, so it's not being delayed by the wider scheme. So we're approaching REBA stage 2, which is full design for the school, ready for the next stages. So that's not being delayed. I thought I'd just highlight that at this present moment in time.
Thanks, Neil, and thanks for joining us this morning.
You're more than welcome.
Nigel and other officers, portfolio holders, is there anything you want to add to this presentation before I go to councillor questions?
Chair, I don't know, hog the mic if any other colleagues want to come in. I think Neil made a really important point there in terms of progression of the school and what needs to happen to actually make the site work from a operational perspective as a school to be built. It then creates space on the site, allows us to then actually, to invest and develop the site further. So it's an integral first part of the site jigsaw, if you want to call it that. And Sally just touched on the various business cases and funding. That's as a key component of this. Is clearly scoping the extent of the project and what health services can be brought in locally is important, but also then there's that that infrastructure behind it and the funding for that, which we're working through at the moment in terms of the SOCs and the PBCs, etc. So I think you've summed it up quite well, actually. Quite a way to go, and there will be significant engagement and consultation as the project progresses.
Thank you. Thanks, Nigel. And Lynette, thank you for joining. I can see in the chat box that you've got to go to the same meeting as Neil. So thanks for joining us this morning. And various councillors have got their hands up. And the first one I can see is Councillor Coroner.
Hello. I'm asking about the academy. What's the purpose and scope of the academy, and what's going to happen to the library, which is Paris's best library?
So if I take your point on the academy first, obviously we know we've got a bit of a ticking time bomb in terms of our health and care workforce. When you crunch the numbers, it's quite a stark picture of outward workforce that will be retiring in the next so many years. So obviously we can repatriate services, we can integrate services, we can streamline services, we can collaborate. Without the workforce, we can't do any of that. So the Academy seeks to grow our own, essentially, and offer in-house education, support, training to upskill staff, to recruit staff. We're having ongoing conversations with the college and how we complement what they do. So it's very much sort of grow your own focus. They have got an academy, health and care academy down in Brontlease at the moment, and that they're just starting to sort of get up and running. So maybe worth having a look at that and how that's operating. But yeah, it's very much about ensuring the future workforce.
I mean, I've heard that you can take what I call an auxiliary nurse up to level 4, not up to level 5, via the rural academy. Is that the same sort of Brontlease? Are you going to offer the same sort of training?
Yeah, it will be sort of a satellite to Brontlease. in Newtown, but we are looking at alternative ways of how we do further educate and train people. We've had conversations with Aberystwyth University and how we can link in there. So I don't have the fine details just yet, but yeah, just be assured that conversations are ongoing, and we will do everything we can to secure that future workforce.
Thank you very much. And the library, will it stay pretty much the same as it is, or will it provide well, books for this learning?
So we are. Sorry, yeah, you go, Nigel.
Go on, sorry. Yeah, Councillor Karina, happy to jump in there if that assists. Hope I don't contradict what Sally was just about to say. In terms of the library facility, the intention is to replace it with a new, more integrated facility that supports both the school, academy, and the existing library users. I appreciate it. It is one of our better buildings.
It is absolutely the best.
It is in a but it is in a very prominent location for the site. So as it stands at the moment, it would be replaced by a new facility.
Thank you very much.
And also, I think we have had the academy has been to Scrutiny previously, when it was sort of more in its early days, and it's something that when we've done our self-assessment at the end of last term, that we really want to, as a committee, stay involved as the academy gets further progressed. So when we come to the work programme, it would be good, Karina, to raise that point again, really, because I think it needs to go on as its own sort of separate item for us to look at.
What? Sorry, you mean training?
No, the actual health and social care academy, which is being developed, which part of which will be on this site. So further on in the agenda, we're looking at other topics that we can look at as a committee. So I think it's worth, I'll try and remember, but it's worth mentioning that again. So Councillor Liz.
Thank you, Chair. Thank you, Chair. I just want to say thank you to Sally and Nigel, first of all, because I do think this is it's a really inspiring project, and I, really hope that, we're going to make it work. But in terms of understanding, I was just wondering if anybody could tell me anything about how this project might be connected to the Regional Skills Partnership, because I can see that there are lots of opportunities for jobs and skills within the project, but also, I should imagine that one of the longer term outcomes is to make sure that, people that use this project are enabled to get into work in a sort of, long-term basis, and to develop skills and education. So could anybody say anything about that? No?
So,
Nigel?
On that side of things. Nigel, are you okay to?
Sorry, Chair, I just got in and I missed the first part of the question. I do apologise, but somebody came in my room.
I was just wondering what connections there might be developing between this project and then the Regional Skills Partnership Board.
Sorry.
Because I'm assuming that there are going to be jobs within this and skills needed, but also that the idea is that in the long term, the people who benefit from this project are going to want and be, upskilled into work for the future.
No, I absolutely. Thanks, Councillor Liz, and apologies for missing the first part of your question there. Yeah, very much so. The RSP would be, as the academy progresses and becomes, becomes more, gets further progressed, we'd expect the RSP and our lead officer there, Aki Cesar Homden, to get quite involved. I sort of lead on the RSP as well for the authority, so it's probably quite a good link there with the role that I've now incorporated with the North Powys Wellbeing Programme. But you're absolutely right that the whole point of the academy on site is to tap into the broader skills programme across the region, noting of course that Skills Academy in the north doesn't necessarily serve the entire county, but certainly important in the north.
Thank you.
Thanks, Liz. Councillor Gareth.
Yeah, thank you. I was just wondering how the health and care provision that's proposed to deliver from this campus compares to that being delivered from Glenurv in Bilth. because I've spoken to many people in the Builth area. Some of them work in health sector, and they are not impressed at all about the services offered for Glenurvan. My understanding is no qualified nurses there. So Glenurvan appears to be a little bit of a white elephant. So perhaps we need to put that on our work programme as well.
Councillor Gareth, I know in our last minutes, I just had a quick look before, and we did talk about with Carly and Sally about there being a lessons learned exercise from where there are similar pockets of things elsewhere, and that might be something that's relevant here, whether or not we are picking up things that aren't going so well elsewhere that we can then apply learning to here, which I think is possibly relevant to the point that Gareth is making.
I think that would be great.
Sorry, we do have a focus on learning from elsewhere, and that's both internally and externally, which is currently going through an approval mechanism at the moment, which focuses on the external. We have also been focused on internal learning. Glenurvan is one of them, and there are other examples such as the integrated care team side in Ustragun Lice. And yeah, what we can learn from those projects, and you know, where things are going well and where they aren't. So it's definitely on our radar. I think the difference between what we're proposing in Newtown and what Glenurvan offers, I wasn't involved in the development of Glenurvan, so excuse my ignorance, but it's really focusing on getting those service delivery models right before we you know, build anything and put people together in a building, and like you say, learning from where things have and haven't worked elsewhere. So what are the principles of integrated working? How do we agree those jointly?
Does everybody have clear roles and responsibilities as to who's, because where there's collaborative working, that's all often the challenge, isn't it? Yeah. I think, Sally, it would be really helpful for the next time that you guys come back to us, if that exercise could be included in part of your presentation.
Yeah, no problem.
If you've completed it by then.
Yeah.
So if we could put that as a recommendation, please, that would be great. Councillor Gareth, do you want to come back on that?
Yeah, no, this is a different point, Chair. I just happened to bump into an ex-colleague in the Rollwell show, and I asked his daughter what she was doing, and she's actually working in a GP surgery, but also doing a part-time nurse training course from Pontypridd, 2 days a week. It's a 5-year course, and perhaps that's something we need to look at as a method of training in-house nurses.
I'll leave that thought with you, as I think that's sort of veering on more the health board side of things.
Oh, 100%.
Yeah, no, that's absolutely fine though. But I'll leave that with Sally as food for thought. Councillors, have you got any other questions? Oh, Councillor Chris, sorry, I just scrolled past your name then. Councillor Chris, have you got a question?
Yes, I have. I've dealt with some of these type of projects previously in my background, so I know a little bit around some of this area. When we're starting to deliver new services or integrated services, they're fine why you've got people that are skilled up. The problem that comes around is when you lose some of those skills and those services then cannot be redelivered because you don't have the expertise. So you are being advertising or promoting a particular service and then you lose them. So what I'm looking at is there discussions going on with the health board and also within the authority around you know, skills enhancements and succession planning, because we need to have that factored in going forward so that we can maintain those skills, because as Councillor Gareth mentioned, if you've got a service that is being marketed as something, it can then end up becoming a white elephant. And I've run into that same issue when I've developed some of those skill sets for a particular service delivery. When the person left for promotion, then we didn't have those skills available and that service then gets lost.
Happy to jump in, Chair, but very generally, if colleagues want to add any more. I'm acutely conscious of the Workforce Futures programme that's been running for a number of years between us and PTHB, and hopefully that's trying to address some of the issues that Councillor Chris has identified there, rightly identified as well. Out of interest, there was also an email across SLT this morning looking to pick up some of the recruitment and retention issues we have across the authority and trying to remove some of those barriers. So I think it's a very valid point, and it will be a challenge for us going forward in future years, Councillor Chris. If I may, Chair, just picking up perhaps on a previous point in terms of learning from elsewhere and avoiding the white elephant type issue.
Yeah.
I know Sally's done so. Sally possibly undersold herself, because I know she's done some really good work in terms of experience elsewhere, and there's quite a few good examples of integrated healthcare facilities across the UK. But perhaps if I just cite a couple of more local examples, there's a recently built, well, I'd say recently built 2019 project in Aberaeron, Integrated Health Centre, and there's also one in Cardigan as well. So it's not like we're doing something that isn't happening and is being successful elsewhere. But I guess the challenge for us, and quite rightly should be, that why isn't it happening in Powys then? So that obviously we're trying to almost play a bit of catch up in terms of the type of facility we're talking about. And Councillor Garth made a very valid point, and I'm very keen myself to find out more about some of the issues in Dunurvan, but I'm straining into uncharted territory, Chair, in terms of my knowledge and experience here, but keen to find out more, and happy to feed that back as best I can.
No, thank you, Nigel. And I think what the point that Chris is making, and he's kind of hit the nail on the head about issues we've raised with this previously, in that when we have crossover services and integrated services, how you ensure that the terms and conditions of everyone's employment contracts and their the documents that outline exactly what they're responsible for are formalized, so that when those people go, you know what you're recruiting for. And I know that we've mentioned previously about sort of more collaborative projects across the border where things have started off really well, but actually where those roles and responsibilities haven't been clear from the outset, things have then fallen apart in terms of governance. So I think it's a really valid point. I can't see any other hands up. Has any other councillors got any more questions on this? Anything they'd like clarifying? I know one other issue that's come up previously, Nigel and Sally, is how, as this grows, how it will be the North Powys Wellbeing Hub and not just the Newtown Wellbeing Hub, and how services are going to be ensured that they reach wider than Newtown, which I presume will be a challenge given transport links and rurality. But have there been any more thoughts or discussions on that side of things in relation to any of the different streams?
I think it's an area I obviously lean on health board colleagues, and I'm not sure if Sally's best placed to comment, but in very simple terms, and I am don't wish to patronise anybody, but clearly if we're travelling out of the county for something at present and bringing that into Newtown, that's going to have a beneficial impact, even if you are still having to travel to Newtown for that service interaction. So hopefully we can provide more of the facilities that are currently out of the county within the county, and once we're able to establish exactly the scope and range of services, we'll then get into a discussion in terms of how we provide and how we facilitate transport. Inevitably, transport will be a key component here, but a facility right next to one of our bus stations has to make it more appropriate for us to centralise services and facilities. I see Sally's got her hand up there, so she may want to come in on a more technical note, Chair.
Thanks, Nigel. Yep, Sally.
I just wanted to add that we're looking at doing a travel times analysis, which looks at where people are currently travelling to, for what services, what the cost is of that, what the environmental impact is of that, and how would that look if we could deliver services in Newtown. So that just doesn't focus on the Newtown population, that focuses on the whole of the North Powys population. And we're just working through the details of that at the moment around how do we apply assumptions for people in, say, the Machynlleth area. You know, do they still travel to Aberystwyth out of convenience, or, you know, if they could be offered a scan or something close in Newtown quicker, would they travel to Newtown for that, or would they continue to travel out of county? So there is a focus on the whole of North Powys, not just Newtown. I think the Newtown part is the third sector community hub aspect of things, where, you know, the community really helped to shape that. But I think the broader offer of the health and social care and the broader campus, I think, is a North Powys offer. And we absolutely look at the whole of North Powys when we're sort of designing services, not just Newtown.
Thank you. And I can see Councillor Gareth has got his hand up, so I'll come to him in a second. But I do just want to say, I do think this is one of the biggest challenges of the project. And I'm hoping that there will be some, you know, creative outside of the box thinking on this. And I don't want to start shaping things in terms of your policy, but potentially thinking of how remote and online things could be factored in, so that people in North Powys can access them or be signposted from people that are working in Newtown, but perhaps are able to have an awareness of things that are going on in other communities in North Powys. You know, we've got some very isolated agricultural areas where there are families that have different needs to those families that are in Newtown, in a more sort of urban area. And again, we've got some very hard to reach elderly people who may actually not know of all of the things that go on in their communities around them. They may not know that there's a local club in their community centre, for example, or families may not know that there's a new sports club being set up in their community. And from an early help and intervention side of things, there might be an opportunity here for some really improved and enhanced signposting, which give a more holistic support to families and people who are quite isolated. So I'm really hoping that that's how things will start to shape, because I do think there's a gap given our rurality. So I just want to make that point, really. Councillor Gareth Morgan, great to see you. Great to have you back on the committee. You're on mute though.
Right, sorry about that. I thought I had unmuted, but obviously not. It's an interesting, very interesting project, and inevitably, I think it's so important that people don't have to travel so far to access specialized services and see consultants, etc. Now, what I'm concerned about is, I have to be a little parochial here, that in the ward that Glyn Preston and I represent, we are fortunate in having a great hospital that has a long history and is much admired and respected and funded by the local community. What I want to be certain about is that services are not going to be taken away from there and placed in Newtown, so that it makes it further for our expanded community to have to travel to access those services. Because we've had and continue to have quite a number of services being provided as an extension from Bronglais, for example, which is our primary source of expertise. But I hope you understand what I'm driving at.
Yeah, I think you're making a point well, Gareth, in that you don't want to lose services that exist already to be centralised, when actually that might not be what's best for each individual community. Sally and Nigel, is there anything you can come back on that?
to take that, Nigel. That's the view.
Sally, your mic is having a bit of a wobble there. Apologies, I was just a bit slow to unmute. I think it's a more than fair point Councillor Garth has raised, and is a concern that you had picked up previously. I don't think we're quite there yet in terms of the absolute detail, and I defer to colleagues in PTHP at this point in time. Certainly, it's not been shared with myself in terms of exactly what, where, and when. And I think it's when we're looking at the specifics of the services that would be provided from Newtown, that consultation and that engagement needs to be undertaken. So probably, Chair, without blustering you further, just a bit early days to offer anything there. And please, Sally, if you wish to correct me, please do so. But happy to bring that back when with colleagues from PTHP when we can.
Thank you, Nigel. No, I agree. I'm sure it is early days. I think, though, there's just worth us sowing these seeds of where our concerns lie.
Yeah.
Yes, I hope it's not something that will be overlooked in the early stages of planning, and then when it's raised, oh well, it's a bit late now. I'm sorry, we've already got alternative arrangements in place, and it is very difficult to revert. So I'd like to think that my concerns are taken into account now when you are processing gradually into more detail.
From my perspective, Councillor Garth, sods very firmly been seeds have very firmly been sown, I'm trying to say, with myself, and I think my own non-technical focus is getting those services out of county into county, not moving things around within the county, in very simple terms.
Thanks both. I can't see any of the hands up, so I don't know whether any of the portfolio holders or Nina, if you wanted to come in at all, or Sally, if you've got any sort of concluding remarks that you want to make.
No, just thank you all, really. It's been a really good opportunity to talk to you all, and yeah, I look forward to updating you next time we're back.
No, thank you, and thanks for coming, Sally. And as we've said to Carly before, we're really keen to carry on being involved with this, as a committee. I just want us to be as helpful as possible. So we are hoping to set up a working group, and as your planning develops, it would be good for you to carry on thinking about where that working group could be most helpful to the wider project.
Yeah, absolutely. Thank you very much.
Thank you.
Thanks. Bye.
Right. Oh, Councillor Glynn, I can see you've got your hand up.
Hi. I was just wondering, do you want expressions of interest now with regards to that working
Well,
group?
I think I'm just going to move on to the next agenda item. I just let me just go back to my other screen. Yeah, so I think anyone who wants to leave, Officer Wise, who is here for the North Paris Wellbeing Programme, thank you ever so much for coming. And I think we're going to move on to just more sort of committee admin type things now, on setting up some working groups. Our plan is to have a few different working groups, initially one for adults and one for children, but as I said, it would be good to have one for this North Paris Wellbeing hub as well. So thanks, officers, for coming, and also portfolio holders. But if you want to head off now, please feel free to do so. Okay, so item 7 is working groups. Yeah, what I was going to do is expressions of interest. Absolutely, Glyn. If you have a burning desire to be on one of these working groups, I think what we're going to do is try and split it half. So half of us are on, half of you are on one, half of you are on the other, and I will come on both as chair. So don't feel like you have to be on both. Don't feel like you have to speak up today. What I was going to do is give you until probably the end of next week, which I think is the 5th of August, to let me know, me and Wynne know in writing as well, which one of these you'd like to be on. I'd like you to think about where your skill set lie, where your background knowledge and where your interests lie. I know, Carol, you've got some previous professional experience in adults, is that right? So
yes, sorry.
yeah.
Yes, that's correct. And I would like to stay with the adults
Yeah.
social services, please.
So if anyone else wants to raise a hand because you know what you'd like to do already, who've we got? Glyn, what about you?
Sorry for jumping the gun there. Yeah, I like to be on that the adult social services. I was also going to ask, and perhaps I'm jumping the gun again, just in relation to that North Paris wellbeing programme as well.
Yeah.
Is this too early in a stage to express an interest in being on that working group?
No, absolutely. I think if we could split it into 3 working groups, and although it may be that North Paris one doesn't have much to do yet because of the early stages it's in, but yeah, that's great that you'd like to do that. And I think obviously councillors that are in the south, it's probably worth you not going on the North Paris wellbeing one, unless actually you're in the Karina, are you in the Knighton area? Because there has been some talk of Knighton accessing that. So
yes.
but if you're really south, like Chris, I think Chris is down in Brecon, it might not be worth you going on that. So Councillor Gareth, what about you? You've got your hand up.
Yeah, I was going to opt for the adult services as well, please.
Okay, that's great. Anyone else know exactly where they'd like to go? Karina.
Sorry, are you talking to me? I haven't put my hand up.
Oh, sorry. I don't know whether my screen is being slow in when people have their hands up. Oh, I can see Gareth Jones has now got his hand up. Sorry about that.
Yeah, I don't mind. I'm happy to go on either the adults or the children's working group.
Okay.
Obviously, I got some experience in doing the special schools in education, but I'd also like to be on the North Paris Wellbeing Group. I know I'm out of the area, but I do know it impacts on a couple of charities that serve the London and North Randshire area.
Okay. I think we'll put you down for children's then for now, and then.
Well, I sent you an email.
Oh, okay. Sorry, I haven't seen that. Councillor Liz.
Children, please, Chair.
Great. And I think that's it. Chris.
As Liz has gone on to children's, I'll go on to adults to give us that balance. But I also think there would be merit. We've heard with 2 of the presentations today about recruitment and retention. Yeah. And I wondered whether there's a necessity to be considering about workforce and building it around this model around codependency with the academy. The reason why I say that is my background is in the NHS. I served 30 years and I was an assistant director in nursing with a focus on workforce and education. So it's my...
Yeah, I think we're going to come on to forward work planning in a minute, but I think you're absolutely right. Workforce needs to be considered for both, really, and how we can maybe do a deep dive in that, and actually make sure that we get sort of up-to-date figures as well on how the picture is looking within the county, and then where we can focus our consideration. I can't see any other councillors with their hands up. Councillor Jonathan, I don't want to pick on you publicly, although I know you know some of the fostering side of things because you've had some involvement with that panel, so that might be something for you to think about.
Yes, yeah, very happy to do that, Amanda.
Okay, so maybe Councillor Jonathan go on children's, but everyone else, if you just email me, that would be great if you could do that by the end of the week. The end of next week. And then I think with Win, we're going to work out how best those groups will then start to take shape once we know what the work programme is going to look like. And so I'm going to move on to that swiftly now because I'm conscious that it's...
Councillor Benjamin's got his hand up.
Oh,
Chair.
sorry, Councillor Ben. Do you want to come in and say...
That's quite all right, Amanda. I'd quite be happy to go on to the children's.
Okay, great. We'll make it into that then. Thanks for that. Okay, right. Moving on to the work programme. I I'm hoping to sit down with Wyn over the next couple of weeks before he goes on holiday to shape this up some more, looking at the self-assessment that Councillor Liz and I did at the end of the last council term, where we there was a few areas where we thought needed focus, and there's a few more areas that have come up today, and there's a few more areas that have come to me separately. So as you can see, as things stand at the moment, our next meeting is in September, when we get the annual complaints report. Wyn, is that for both adults and children's?
I'm not actually
No,
sure.
I'm not. But and at that meeting we're going to be having a briefing on adults as well, which I think is really worthwhile us having, because we've had the briefing on children's. We have got a pre-meeting put in there as well for that, but I think I'll wait and see as to whether or not we add anything else to that agenda, as to whether or not we need that pre-meeting or not.
Just to let you know, Chair, I've already emailed finance colleagues just to see if we can get the briefing set up on budgets for you.
That would be great. I think it would be worth the adults general briefing happening before the adults finance briefing.
Yeah, that's fine.
But obviously we've already had the children's one. And then obviously then in October, at the end of October, we're coming on to general performance within the services, and also the quarterly finance performance that is already part of our work programme. Councillors, we also get monthly performance reports. The last one I had was the children's one for May, Councillor Sandra, but actually what we used to get was, well, it's always been a bit sporadic, but what I would really like is to get monthly performance reports, one for adults and one for children's, and so that Wyn can put them up in our teams, so that if there are any themes and patterns occurring, because they show the number of people that are leaving, they show any assessments that are happening out of time, they show the numbers of adults waiting for dom care assessments, for example. It would be really good if those could automatically come to us on a monthly basis for us to read at our own leisure, because that's kind of the first place where we would spot areas we want to question or challenge or do a bit of a zoom in on. So that's a request from me. So I don't really want to go into too much detail on what else I think we need to put on the work programme, because I think Wyn and I need to have a sit down. Have councillors other than Chris, I know you've mentioned about workforce, and actually Councillor Glynn, you messaged me about something as well, didn't you? Was it to do with grow your own and retention?
Yeah, that's exactly it. And I wonder if there was a...
Yeah, I think that needs to come into the workforce one, because that forms part of that picture. So I think, Wyn, if you could make a note that workforce is something that we would want to have some have an actual full session on, that would be good. And then we can go through the other things that have come up previously. I know day centres has been something that we've said we really want to look at what that's going to happen with that in the future. Residential placement figures for children's and how that's shaping. Councillor Liz has mentioned about that. But we just need to have a bit of an exercise where we group some of these things together, because some of them are quite specific areas that may only be, a 20-minute discussion. Or has anyone got anything else they would like to sort of put forward as something that they feel needs to go on the workforce, on the work programme? Councillor Gareth, I can see your hands up.
Yeah, it's not to go in the work program at the moment, but what I would like is, you mentioned some of the KPIs and the performance indicators over the trends for this year. What I'd like as a new councillor, I'd like to have something that so we can see the trends over a couple of years, if possible.
We can probably get trends on things like looked after children numbers and how that's changed over the years. I don't know, that's Wyn, that's possibly a question we need to put to Emma Palmer.
Yes, sorry, Jay. Yes, we can do that.
Yeah, okay. I'll leave that with me, Councillor Gareth.
Cheers.
Sian.
Thank you, Amanda. I'd like to ask for some work to be done on looking at provision for adults with learning difficulties. And
yeah, I've got that on my list actually.
Yeah, have you? Great. Just looking at
I've got that as
meaningful occupation, but also developmental occupation. So, you know, really exploring whether their potential for contributing to the community and being active and involved members of our community is being maximised, and are we really supporting them to do that? And if we're not, can we? And what would that look like?
Yeah, and I think as a committee, we haven't actually looked at what services exist for adults with learning disabilities. So it would be good for us to have that. I think that's possibly something that a working group that could go under the adults working group.
That would be great.
Yeah.
Sorry for my ignorance about protocol. As portfolio holder, would I be part of a working group or not?
I don't know yet, actually.
Okay.
Councillor
I'm
Sian,
glad it's not just me.
I think historically we haven't had working groups since before the pandemic, and they were set up after the adults and children's inspections in 2018, and at that time they were not public meetings, they were sort of task and finish groups. And I can't remember whether portfolio holders came to them. I think leave that with me and Win, and as the work programme takes shape, we'll have a think about how best that's gonna be. But certainly I would like to have sort of quarterly catch-ups with you as chair. So yeah, Councillor Liz.
Oh, thank you, Chair. I've got two things. The first one, I think, probably clusters with some of the things that we've talked about. So I think if we're asking Emma to look at some stats, I wonder if she could look at the relationship between the front door, child protection, and then the number of children going into looked after services, because I feel I need to understand that, and I'm sure others might, a bit more, and the impact that would then have on the workforce. The second thing, Chair, I don't know whether this is for the work programme or whether it would be something that we would benefit for a sort of presentation or an update on, but if you remember, a while back we had a presentation about extra care for adults, and the the connection with existing older persons accommodation across Powys.
Are we talking about assisted living?
I don't think it's assisted living. I think it's, well, extra care for adults, but it's sort of very dependent on some of the older persons' places that are in existence. For example, Trenuath in Brecon and Green Hills in Crickhowell coming to the end of their life. So I think it would be helpful, to know what progress is being made on that. Is it called assisted living? I'm sorry if I've got that term wrong. I was thinking of assisted living with young people rather than.
I think the assisted living is like the new centre in Welshpool, where it's a residential place, but allows elderly people to live slightly more independently.
That's right.
And that there's sort of services there that they can tap into if they need to, but it's a bit of a mixed provision.
That's right. You can move through it. That was
yeah.
They kind of may go in, but they don't need to move as their care progresses. They can stay, but be given different. Yeah, that's what I mean, Amanda.
Yeah. Okay, I think it would be good to get an update on that. We absolutely. From Dylan and his team, because we've had sort of some early stages on that previously, so I think that's I'm not quite sure of what the service is fully called though, Liz, like you. So
I think it's extra care for adults, adult extra care, because I saw it in the report that Caroline went through earlier.
Yeah, okay, great, thank you. Councillor Carroll. And I'll take this as the last one because I can't see anyone else's hands up, and then I'll bring the meeting to a close.
There's also Dorothy Hughes House in Welshpool as well that helps the elderly.
Okie doke. Is that part of, is that Powys commissioned as well? Then that's through residential, isn't it? Yeah, I think it would be good to know what the future plans are. And I know that Dylan has brought presentations before on schemes that they're developing across the county. And it would be good to know well, how things have changed over the last few months. Right, and on that note, if you've got anything else which you can think of on the workforce future programme, sorry, on the work programme future, please just drop me an email, and me and Wyn can then factor it into the scheduling. Wyn, in terms of meetings, we usually would only have one a month for the full count for the full committee, but what are we thinking for working groups? One a month for each of those as well, or not as regular as that?
Possibly not as regular, Chair. Depends as well on if, I think we need to set out terms of references for the groups and try and actually plan some sort of work program as well going forward. That'll help us try and work out how often we need them to meet, etc. So I think we need to do a little bit of work as we're forward planning the committee. I think we need to do the same thing with the working groups and just actually have a clarity in mind of that will go to committee, that will go to working group, that would do what that could be sort of virtual, whatever we want to do with it, and just have a bit of a mix and match. But as long as we've got a plan, it should help.
Yeah, I think there's some work for you and me to do, isn't there? And I'm sitting down with Nina and Lynette as well over the next sort of few weeks, so we can think a bit more strategically as to how best this committee can.
Yeah, and we also have to bear in mind, obviously, capacity within the teams themselves to actually provide background information to us. So that's another factor we've got to watch out for.
Yeah, no, absolutely. No, so thanks everybody for coming. Thanks to the portfolio holders, Sian and Sandra as well for coming. And I think and Sue, I've just seen that Sue's here and I didn't know that Sue was here. Thanks, Sue. I haven't said hello.
Thank you, Chair. I didn't get into the meeting till 11. I've had terrible IT issues this morning.
Okay.
About 11 o'clock, so I did join you just after that.
Okie doke. Well, don't worry at all. Right, but on that note, I will say hello and goodbye to you, and thanks everyone for coming this morning. And me and Wyn may be in touch further if we want some input on how things shape over the next 6 months, really. But thanks very much, and I think the live meeting can stop.
Thank you.
Thank you, Chair.
Thank you.